Here's your host, Alex Garrett.
All right, to end the week on the Alex Garrett Podcast Network, I wanted to drop a couple of adapting conversations. And on this edition of Adapting with Alex Garrett, let's talk to Kerico, Kerico, about how they're changing the game for medical transportation. Here's my conversation with Chis Ochs, the Chief Development Officer for Kerico.
What if you can't make your doctor's appointment because of transportation? And my goodness, when I saw this press release released for Chis Ochs, I just thought I had to get Chris on. Chris, I'm so glad we're going to talk about this access to reliable non-emergency medical transport services for patients, healthcare providers, and communities. Tell us about yourself, Chris, and thanks for joining Adapting with Alex Garrett.
Alex, I'm flattered to be on your podcast. Thanks for having me. I'm the chief development officer of a company called Kerico Healthcare. We are effectively, on the outside, a non-emergency medical transportation company operating in Texas and Arkansas. But the guts of the operation are very similar to what are called transportation network companies like Uber and Lyft, in which we can expand nationally, and that's what we're trying to do. The technology is out there for more needs-based transportation companies, and our company is focused on getting people with disabilities as well as senior citizens to their medical appointments. Go ahead. Sorry, Alex, go ahead.
$150 billion a year, and that's because a patient, it's weird to call ourselves patients, but that's where we are sometimes, right? So when a patient can't make it to the appointment, they get charged. That's a whole separate issue. I don't think that should be right, because the healthcare industry should take into effect, hey, these people can't get where they're going, right?
That's right. So that the number is, it comes from the National Institute of Health. It's $150 billion in healthcare lost every year to what are called no-show appointments. Now, these are appointments that are kept on the books, but they're not canceled. The patient just doesn't show up. Now, transportation across all numbers, the aggregate, 7% of the time, a no-show appointment is related to a lack of transportation. But when you get into disadvantaged communities, disabled individuals, and senior citizens, the reason for no-show appointments being related to transportation is sometimes 50, 60, 70% of the time. And just here are a couple statistics that I share with people, and they always say, wow, I find that surprising. 1 in 4 seniors no longer drives. 1 in 2 seniors have a difficult time getting somewhere on any given day because of transportation coordination. 1 in 4 Americans have some sort of recognized disability, and 13%, that's actually 12.7% of Americans have a physical disability. So aging and disabilities prevent the medical industry from doing what they're supposed to do. And I always say transportation, when it comes to healthcare, isn't sexy, okay? It's not new pharma. It's not an IPO or mergers and acquisitions. But boy, good, reliable, safe medical transportation is imperative for keeping the healthcare industry in the black, for keeping patients healthy and living longer, and for I think it's better for us as a society as well.
Kerico, the transport products you offer, whether it be a wave vehicle, wheelchair access vehicle, and whatever else, it doesn't look like an ambulette though, right? So they can go with some sort of dignity. I have to ask that.
I'm glad you asked that. Yeah. So we have sedans and we have wheelchair vans. All of our drivers are CPR certified. We have the ability to help patients. We call it door-through-door service. And so we're not curb to curb. We don't just show up, wait 5 minutes, and leave. We will come into your building, across the threshold of your dwelling, if you will, your front door, help you get down to the vehicle if needed, whether you're in a wheelchair or you're independent, get you across town to the appointment, get you checked into the reception, and then do everything in reverse. And it's subtle and discreet. Our sedans are not, we don't broadcast that we're NEMT. We have a similar to our colleagues over at Uber and Lyft. We have a little window decal. And then we do have branded wheelchair vans, but I have to say they're gorgeous. And we think they actually look pretty sharp. So we're very, very sensitive to this. And if I can just say, the reason my background is business, it's Fortune 100, and I spent a lot of time in retail. But the reason I joined Kerico is I've known the founder, Mike Morris, for many years now. And he started Kerico because he had his mother was ill with cancer. Unfortunately, she's no longer with us. And he's down in Houston. And he was spending a lot of his time and day and energy away from work, helping his mom get from point A to point B. I, conversely, live in Minneapolis. My mother is disabled. She's 74. And I spend a lot of time, or have spent a lot of time, helping her because I don't trust certain other companies with my loved ones. And so we went out to create this company that we want people to trust us with their moms and their dads. And I'll tell you what, we've given 250,000 rides to date since 2018. And we have a 0.2% complaint rate, which is like the industry best. So we do care about people. We care about their dignity. We care about their safety. And we train. I know I love our company, which is why I'm rambling. I'll leave you one more data point, Alex, which I think you might find interesting. The Kerico difference is we spend a lot of time training our drivers on patient empathy. We have cancer patients, we have dialysis patients, we have people going through the hardest times of their life getting into our vehicles. The last thing we want our drivers to do is to be insensitive to that. So we stay away from topics like religion and politics. We try to keep things light because I'm sure this is true in New York City. I know it's true in Minneapolis. I know it's true down in Texas and Arkansas. The average doctor appointment for us as patients, we're lucky to get 20 minutes with our doctor. But the average ride that we perform for patients is 29 minutes one way. And so it's very common for a patient to spend more time with our drivers than they will with their doctors. And so having an empathetic driver who understands patient needs and dignity and privacy is essential.
Let me tell you, no, this is great. And just so many follow-ups I can ask you here because there are two facets I'm thinking of. And when it comes to New York City, where I'm based, and Long Island as well, Uber and Lyft are only accessible to wheelchair access in New York City and the 5 boroughs. We don't have that here in Long Island. So would Kerico consider starting a branch? Have you started a branch out here? And then what about competing with Accessoride? I mean, look, Accessoride wait times, I'm sure you know, are ridiculous getting to and from. I feel like Kerico could be a game changer here.
Well, thank you for saying that, Alex. Here's the thing. Our big goal, okay, is to be the household brand name when it comes to patient transportation. We want to be the Uber and Lyft of patient transportation. We want to be nationwide. And we are looking at New York and some other states. We hope to be in Long Island soon. My dad married a gal from Long Island. I'm familiar with Babylon. I love it out there. People there are great. But
my whole family is out there. The Donna, Debbie, all of them are out there. So I grew up in there a little bit too. Great place. Great place.
So when it comes to our operating model is one in which we partner. We can take ride requests directly from patients. Most of the time, we work directly with insurers, Medicaid, or the providers. So what provider might, hopefully your provider is saying, hey, Alex, you have an appointment next week. Do you need a ride? And Alex says, yes, I need a ride. And then the provider would say, okay, well, we're going to get Kerico to come pick you up. That's kind of our model. And we do most of our ride booking at least 24 hours in advance because when the rides are being provided by the providers, they book stuff out. However, we're becoming more effective at same-day transportation. And I'll tell you this. We have a partner down in Houston Methodist Hospital, wonderful teams down there. They're the 8th largest hospital in America. And they've had an issue with hospital discharges. Patients come in, they get discharged, and then they wait. Maybe it's a 4-hour wait for an ambulance or whatever it may be. So we've been really honing in on our same day delivery. And so what we try to do with our sedans down in that case is we're down to like a 40-minute wait time for a sedan and generally under 2 hours for a wheelchair van ride. And we come in for the wheelchair van rides, we come in at like half the price because that's how we're structured. We don't have a big expensive corporate team. We run a tight ship. We invest all of our money into driver training and making the most for the patient, getting the highest quality service.
Let's talk about affordability. So here we are. Access to Ride has raised the rates once again for crappy service, right? Can I just be political? Not political, but can I just say what it is? It's crappy service. So
yeah,
why do these companies who haven't been in the shoes of someone who's disabled continue to think, oh, a person with disabilities can afford this or that?
Well, I'll tell you why, Alex. It goes back to what I said in the beginning. Uber and Lyft, I praised them for one reason above all, and they broke the mold using technology to create a transportation network company versus the old school model for non-emergency medical transportation is you've got a guy or a team of people and they buy a bunch of vans and they hire drivers and they have a radius and they dominate a small market and they can charge whatever they want because they're the only game in town. Uber and Lyft changed the game with technology. And so now, you can have a California-based company operating nationwide. The democratization of transportation is happening. And the ability now for smaller companies like Kerico to come into Long Island and to give the other companies a run for their money, it's great. And I encourage other people to get into this game. There are millions and millions of patients out there who need rides. I don't want America to wait for Kerico to expand. I want to see some competition, man. It's all about competition. It's all about getting the price down. We try to be transparent in our pricing. Our pricing does vary from region to region because it has to, cost of living for this and that and whatever. We take it all into account. But I'll tell you this, you and I both know this as first experience as everybody else does. When it comes to transportation, we're like the only part of the healthcare journey where you know what you're paying for before you pay it. Right? How many times have you gone to a doctor's appointment and then 6 months later you get a bill for $900 because they cleaned out your ears or whatever it might be?
It's amazing you say that. I got a $1,000 bill for just looking down my nose and throat just because I have had a little congestion. And of course, I'm not proud of it, but sometimes I have to use I need financial aid here because, I don't make enough to cover that kind of bill. And I guess that's not what this conversation is about, but I'm just saying I get hit with those bills all the time. I know what you're talking about, Chris.
You, me, and 300 million other Americans. So I don't know. I getting back to your question about the competitor that's up there. The more competition is going to hopefully bring the prices down. Now, how do you get more competition? As patients, we need to be vocal. We need to tell our doctors that transportation's an issue. There's a oncology department that we're talking to right now, and they've said for the last 14 years that this particular leader has been in that building. For the last 14 years, transportation is the number one barrier to care. That's not just at that building. That's not just with that oncology department. Transportation in America is becoming a real need. Because here's the thing. You remember 8th grade, right? And the Venn diagrams where you had 3 circles and they all overlapped in the center? The 3 circles.
Yes, yep.
Okay. So the 3 circles that I always use are the following. These are all independent statistics. Okay. 1, Americans are getting older. 2, Americans are getting sicker. And 3, Americans are driving less. And so where all 3 of those circles overlap, you have a real need for patient transportation in healthcare. And the more that we can speak up as patients, not just patients, but advocates for our loved ones as caregivers as well, Things are starting to change. You know, go
and
ahead.
adapt, and adapt. Now I got to ask you, because when I think of Texas, I think of, all right, it's this. I've been there. There wasn't any wave access. It just was insane. My ex and I would roll. She in a power chair. Me and my roller skate would roll from near AT&T Stadium in Arlington down to University of Texas Arlington for the wheelchair basketball, because there was no transportation. So I feel like there's a real niche for you guys at Kerico to break in there, and I'm sure you already have.
We're trying. We're trying. It's the path from start to finish is never a straight line. It's squiggly, right, and goes in every direction. We're working on some things that we hope will be able to allow us to expand quickly. I will tell you this: we are able to win over people and healthcare plans because of our quality of care. We, as a company, refuse to grow faster than we can provide excellent quality of care. Without the quality of care, there is no Kerico difference. Kerico would just become another company. So we're the ability for us to scale is actually, it's quite easy for us to scale, because we pay our drivers well. We've got a good little corporate culture, but it's really finding the right drivers who are empathetic. But anyway,
Chris, would you agree? Everywhere. Would you agree that those who take a Lyft and Uber wave access, just make friends with the driver who's taking you, because you never know where that connection can grow? We've had many a car, and I strike up a conversation because I'm like, this could be a guy or gal we can utilize down the road if we need it. I mean, there are people willing to extend beyond the apps and maybe even into your network if you just had the right connector.
Yeah, we've poached our fair share of Uber and Lyft drivers. And one of the things you said, it resonated, reminded me to bring this up because of, I really do think we hire good people. And what's happening is we're finding that certain patients who have regular appointments, like oncology appointments or dialysis appointments, who are going to be going once or twice a week, they will request a particular driver by name. And what's happening is friendships are being developed between the driver and the patient. This is particularly true with the senior citizens that we provide rides for. I'm sure it's the same with disabled people, as I know it's the truth with my mom. A Kerico driver might be the only human being that the patient is in the presence of for a couple, or maybe the first person they've talked to in a day or 2 days, or the first human contact that they've had in a week. So they really look forward to seeing a friendly face, and they really look forward to that routine. And so I don't know, when you start talking about Uber, Lyft drivers, I was just thinking about those relationships that we're starting to build, and they're impactful, man. We get a lot of patient stories who are very grateful, not just for Kerico, but for specific drivers. And it's a beautiful thing. It really is. Did I bore you, Alex? Is that why you're not?
Not at all. Ironically, I'm getting on a train to New York as we're speaking. So you see, always adapting and traveling. Yeah. So my life is basically this: is transportation all over the place. A couple of other thoughts that have come up while you're talking about all this is, can you break down numbers? Because I feel like chemo is one of the biggest issues for everybody, and getting the chemo is so important. How do you guys change the game for that, for cancer patients?
Well, what we would like to see more of, obviously, is just to be transparent about how we bill, right? So the oncology department will hire us to go bring a patient in. We bill the oncology department. Now, whether or not that oncology department wraps that up into insurance or pays for it themselves, or bills the patient, that's really between the oncology department and their billing cycle. But I can tell you that, we do have patients reach out to us directly for rides. And I don't really want to get into pricing specifically. It'd be impossible for me to tell you what a ride in New York would cost. But it all depends on the needs of the patient if they need a sedan versus a wheelchair van ride, and then what the distance is. But one of the
Because some people don't
Yeah, go
realize
ahead.
the struggle. Some people don't realize the struggle for those who have cancer and dialysis to get to their
They
weekly
have to get to
appointments,
their
right?
appointments. Yeah, or they could possibly get very sick and die. Yeah, it's I'll tell you what, this is why we need to be vocal as patients, right? Uh, listen, I love this statistic. It's so impactful. Every dollar spent in non-emergency medical transportation to get someone to a care appointment saves the healthcare industry $11 in emergency room care. And so it is beneficial for healthcare providers and insurers to get the patient to the preventative care appointment to avoid a scenario where they're paying 11 times as much money for an emergency room visit because the patient wasn't able to get to their primary care appointment.
Chris, when someone uses Kerico, right, and whenever they want to get to their appointment, they want to be brought in a good mood. They don't want a driver that maybe has had a bad day and whatnot. So would you say when they take Kerico, that sets the tone for the entire day? Because then, hey, if they feel empowered to you guys, they'll be empowered to speak up in the doctor's office too.
Yeah. Yeah, I love that you mentioned that, man, because it's here's the thing. Most of us, when we think of the patient journey starts when you walk into the doctor's office. That's not how we see it. We think that the patient journey starts when the Carico driver knocks on your door to come get you. The goal is from that point all the way back to when we drop you off back home, is that we can be, have a level of human engagement that maybe gets you talking, especially if you haven't had a lot of communication, or if you had medications for depression or something like that. We want you to start feeling good about yourself. That way, by the time you actually get that 10 or 20-minute visit with your doctor, you're already talking, and hopefully you're in a good mood. Hopefully you had a good ride there. Because communication, as we all know, we all know this. An effective doctor appointment is one where clear communication from the patient starts. And then lastly, I just want to say this. On the way
So you're
home.
basically,
Yeah, go ahead.
yeah,
Go ahead,
I was
Alex.
saying you're empowering people to be advocates for themselves. That's what I'm hearing, Chris.
Oh, dude. Yeah. Yeah, absolutely. It's wild. I studied medical sociology in college, and I graduated a long time ago in the late 90s. And then I went into business and whatnot. But I remember certain things about those days studying medical sociology. And they said back in 1999, they said in 20 years, $1 in $5 spent in America will be spent on healthcare. And I thought there's no way. There is no way that's possible. But then, where I live over in Minneapolis in the suburbs, and I'm sure it's like this everywhere I go, you go down these main thoroughfares where there used to be office buildings, and in those buildings were whatever other businesses. They are all healthcare related now, whether it's an oncology appointment or an MRI or an eye doctor or whatever. We as a society spend so much on healthcare. And the fact that transportation is still a barrier is mind-boggling. And so we really just need to speak up.
Chris, let me ask you
That's
this.
what we're doing. That's what you're doing. And I love your podcast, by the way. I've listened to several episodes.
I'm trying here now. When you get to know people with disabilities through this app, did it change your perspective?
I think for me, and for some of the other people on the Carico team, especially our drivers, we see disability in our lives every day. Me dealing with my mom in particular, I am always, I don't know, I get goosebumps when I see how a lot of people won't let certain things stop them. Meaning when I see disabled people just kicking ass and taking names. I love that. It just makes me feel so good. But there are some disabled people who need a little bit of help, a little helping hand, and that's where we can come in. It's really what we do and what we genuinely are passionate about. So
On that
yeah.
note,
Yeah.
Is there ever going to be like a time where Kerico can translate what you're doing in the medical field into leisure? Like, okay, well, if we can get people to doctor's appointments, we can get them to the baseball game or the football game or something leisurely as well.
Man, I just had a phone call about that. Before our conversation started a quarter into the hour, and for the first 15 minutes, I was talking to someone about that. I think, yeah. I mean, we would love to be the transportation company for all senior citizens and disabled people in America. Now, realistically, we need some competition. There are plenty of good people out there. This is transportation right now is one thing that AI can't do for us, right? As AI steals job and technology steals job, transportation. I'll give you a perfect example, Alex. Going back to healthcare. So telehealth. It's a beautiful thing. We need telehealth. I'm grateful for telehealth. When my kids were babies, we were on telehealth calls all the time. But one thing that's interesting about telehealth is that 30% of all telehealth calls in America lead to a physical doctor's appointment. So although telehealth is leveraging technology for the better, there's always going to be a need, at least in our lifetimes, to get a person from point A to point B. And to your point, a sporting event. Yeah, watching a sporting event on 100-inch TV is great, but it ain't like being there. So, it's America is
Yeah, I
turning
know.
around.
It's better to be at the ball, the field at Minnesota. The Twins, the Vikings, and to actually watch on TV. I know
Unless
that.
it's snowing 10 inches, and I'd rather be at home.
Well, that's true, and that's why they have the dome
Yeah.
for the Vikings. Not so much for the Twins, though. That's made it interesting at certain parts. But I got to ask you this, Chris. You mentioned the medical field. Do you have former healthcare professionals that are driving for you that kind of know the way around dealing with patients, if you will?
Yep. We actually, some of our drivers are nurses. We have healthcare experience all along the employee base in our culture. We do have a board. Our board members come from United Health Group and some other big firms. Some of our executive leadership, we've all had some touch base in the healthcare side, either personally or professionally. I was talking to you about my mom being disabled, but I used to have a career in consumer electronics, and I was there for the advent of aging in place solutions. And then across our dispatch team and our operations team, we have former employees of different healthcare organizations there. And to be honest, when it comes to our drivers, driving for Kerico is a calling. It's the same as people who want to be nurses, because even though our drivers are not wearing gowns per se, or scrubs, they are caring for patients from the time they knock on the door to the time they bring them into the appointment. So yeah, man, we are stacked with a really good sense of what it means to be a patient and how to care for people with the utmost respect.
Now you're dealing with the finances, so I got to ask you this. I'm addicted to using my HSA card for different things, and I feel like that you guys use that for transportation, right? You can use your HSA card for that.
Yeah, 100%. 100%. Yeah. That's a good point. When it comes to patients actually paying for rides themselves, HSA cards work. I will tell you this. I'm going to give you our web address. Our website is being updated as we speak. It's been our new website has been in the works for a few months now, and we're tying it into our new app. So we were using an off-the-shelf booking app, which was great. It was fine. But we want to have the best proprietary app for healthcare transportation in America, and we feel like we've built it. But I want to give you the website. It's kericocare.com, KERICO care.com. Take a look this week. Take a look next week. They're going to be different. But yeah, I mean, if they're in for your listening viewership in Arkansas, and Texas, we're there right now. We are present. We will have news about new states soon. New York is there's a couple of reasons I want to be in New York. I can't say we're going to be in New York this year, but a couple of reasons why. One, I love New York. I love New York City. I love Long Island. I want to have reasons to come out there and visit as often as possible. But more importantly than my own desire, there was an article that came out last year. It was in the New York Times or the Wall Street Journal. Forgive me for not knowing which one it was. I get those two confused a lot. But it was on the importance and the need specifically in the city about door-through-door transportation services. So anyone who has had, who's been anesthetized or has had plastic surgery or their eye is dilated, these doctor offices will not perform the procedure unless the patient guarantees them that they have a ride home. And so too often, the uncle that was going to pick them up or the loved one or the friend, they cancel at the last minute. And so these providers in New York City are looking for door-through-door transportation services that they can rely on to bring the patient in and take them home.
A couple of thoughts here, because
Yeah.
I didn't ask you the most important question. It's an app, and everybody has the Uber app and the Lyft app, but tell us where Kerico can be different from the apps we already have today. Tell us what makes you guys stand out. Beyond just being a wave vehicle.
So first of all, I want to say this. I think this is becoming more increasingly important. Although we have an app, which people will be able to download probably, in a few weeks from now. We also have a phone number. Okay. Why is a phone number important? I'll tell you why. I keep referencing my mom, but we have senior citizens who have their $1,000 iPhones who, with respect, don't know how to use them. I mean, my mom has called me before on the phone saying, how do I call an Uber? I was like, Mom, you can't call an Uber. You have to order it on the app. Well, how do I get an app? Well, you have to download it. Go to I don't know how to do that. Phooey. Right? And she gets frustrated. So we have a phone number that you can call. It goes right into our dispatch team. And then the app is the app's very user-friendly. It's going to be very user-friendly, I should say, just kind of like a Uber and Lyft. But for us, it's the back-end data that's important, because we can do all kinds of stuff from our operations side, which will at the end of it all, help the patient have a better experience. So I don't think, I can't, Alex, I can't answer specifics about the app, simply because if I do and I say something incorrect, my CTO will slap me on the back of my head and say, "What did you say that for?" So maybe, I would love to, when this thing's up and running, I would love to come back to you and walk you through.
Oh, dude, this is just an introductory conversation. I feel like we're going to build a relationship here and a friendship here, Chris.
Oh, I hope so.
We're bouncing off each other like we just met each other 15 minutes ago, but here we are talking that we've known each other forever. So it's great.
Right on, man.
No, and I'll tell you the other thing about transportation and people with disabilities and their, I hate to say moods, but how does the driver deal with someone who may not be in a good mood that day because they have to go to a doctor's appointment? I mean, it's stressful for a lot of people.
It's a great question. Sometimes patients don't want to talk, and sometimes patients do want to talk, and our drivers need to get kind of a sense. You can. What is it, 80% of communication is nonverbal, right? So when we knock on a patient's door, and if they seem flustered or confused, we need to be extra sensitive to that, rather than if they open the door and they're bright-eyed and bushy-tailed and ready to go. And so in either case, our drivers, a lot of it's natural. You can't train sensitivity, but the best drivers, they're the ones who know how to deal with that. So if the patient's having a bit of a difficult time, maybe it's kind of a quiet ride. Maybe if they have they don't want to hear any music, or maybe they have a music request, we can ask that. Is there anything you'd like to listen to? You want the news? You want some Beethoven? You want some Metallica? What can we do for you? But it all comes down to patient sensitivity.
Tell us about rapport with aid. So my fiance has aid, every day pretty much to make sure she's okay. And do the aides accompany? Are they allowed to accompany the patient
Totally.
to the different doctor appointments?
Absolutely. Yep. 100%. We just need to know ahead of time if there's going to be an aid, just so that we just we like to know as much information as possible, but aides are always welcome. One thing that we found is for patients who, especially disabled patients who are married with a spouse, and the spouse is typically their caregiver and their transportation provider, we are trusted, right? So it is common for us to take the patient to and from the doctor appointment, and it gives that spouse a little bit of downtime, time to do whatever they need to do. Maybe they need to tidy up. Maybe they need to take a nap and rest. Maybe it's a good opportunity for them to run out to the grocery store or whatever. But the patient is happy, but the caregiver is really happy too, because caregiving is hard work. For anybody out there who's helping to care for their loved one, it's a full-time job, and it is it's overlooked by society, just like so many times being a parent of a young child is. It's constant care and attention, and so when we can help to relieve that stress and give the caregiver just some peace and quiet for a time, it can make everybody in that circle, their lives just a little bit better for a day or two.
For those listening in Arkansas and other places that have Kerico now, I see you have extensive background checks. Tell us about that.
Oh, well, yeah. I mean, background checks are essential to finding the right drivers, right? So we do typically do a criminal background check. We do a driver background check. And they're very thorough.
Which I don't believe Uber and Lyft do. I feel like anybody can join those apps, to be honest.
No, we do need to give Uber and Lyft their due. Okay, I mean as part of my experience, I wanted to see what it would be like to sign up for Uber and Lyft to drive, and I did, and they're very thorough. I think that I've always said this, even though we compete with Uber and Lyft in this customer segment, I'm grateful for Uber and Lyft for breaking the mold, for creating the ability for transportation network companies to exist. But I say this, and I think I said this earlier, if not to you on the other call I was on earlier today, this democratization of transportation is happening. If you remember early days of social media, right? But even before Facebook, there was a company called Friendster, right? Friendster and then Facebook, and Facebook was dominant for so long. But then different customer segments, different needs came out, which is why we got Twitter and Snapchat and now Truth Social or whatever it is. There's something out there for everyone. And so when I look at Uber and Lyft, I think 60% of Uber's revenue now, if not, I know it's over 50% of Uber's revenue now, comes from food delivery, not people delivery. And so Uber, to their credit, they've done a good job, but their breadth of scope is very, very wide, but not particularly deep. Our breadth of scope is very, very narrow, but very, very deep. And so we're going to see more transportation companies leverage the technology behind an Uber and Lyft, and they're going to have different different customer segments. So to your point, Alex, earlier, you asked me if we would ever get into something like bringing a disabled couple to a sporting event. If not us, then someone will. There's a demand for that. In and out of concerts, yes. If not us, then someone will. Anybody who wants to start a transportation company, I think this is the time to do it. I think that the advent of transportation network companies in America is the biggest transformation of transportation in American history since the advent of commercial aviation. It's right here. It's right now. If there are entrepreneurs out there listening to this, think about it. People need rides.
It's so funny in the sense that you're encouraging competition, but I guess that's the point, is that you don't want to be the only one out there that offers this. You want to maybe create a whole network of those that are driving, helping out people with disabilities because of your own experience and because of what you're seeing through Kerico.
Alex, I want you to get to wherever you want to go whenever you want. I want my mom to do the same. I want people to get mobile, and it takes a village, right? I'd love to see competition in the marketplace because it keeps us all honest. Best man for the job is going to get the greatest ratings, and Kerico will take the Pepsi challenge against any other company anytime. But I do think that the reason we got behind this was to help people get from point A to point B. And I want to see more competition in the market all the time.
Well, Chris, I got to ask you this.
Yeah.
This has been a great conversation. I feel like we could talk for hours on this, even as I'm on the train, ironically, right? Transportation.
Yeah.
So, no, it's so vital that that's happening. And I'm losing my train of thought. Oh, Kerico. So you guys are throwing money at advertising in a sense, getting on podcasts. So why now? What's the reason for pushing it out now? What are you guys seeing as far as, success and even money coming in to throw it at getting on podcasts and getting the word out there now?
Yeah, I'm glad you asked that. We, over the last 2.5 years, we made some changes internally. We honed our skills, we honed our hiring process, our value proposition. We really kept below the radar. And we didn't want to, a lot of startups, they'll in any industry, a lot of startups will plant the flag, shine the spotlight on themselves and say, we're here and we're growing and blah, blah, blah. And then something bad happens and they vanish, right? We wanted to be the best company possible to present ourselves to the American public and the American healthcare system. And finally, I would say in the last 2 to 3 months, we've been venturing into this world of, seeking a little bit more attention, in part to grow our brand, but also in part to shine a light on the issue of transportation. It is baffling to me that it gets so little attention and focus. And again, I said it earlier, it's not sexy. Transportation's not sexy. It's taken for granted. It's taken for granted. But if you don't have it, you can't go anywhere. What's the point of a brand new big pharma drug if a patient can't get to the doctor to have it prescribed? If a patient can't get to a pharmacy to have it fulfilled, there's no point in it, right? What's the point of all these doctor's offices if you can't get there?
Right.
So
right.
Anyway.
And it costs $150 billion annually for those who can't make it. That's astounding. Now, it's clear that Kerico is a small company and a small business company, I should say. So word of mouth was where it all started and how it grew, right?
Yeah, it is. It is. It's a great story here. Mike Morris, the CEO, was at a luncheon a few years ago with network lunch. You have some lunch with some people, you get to know each other, you handle business cards. What do you do? Nice to meet you. Okay, blah, blah, blah. He was at a lunch with some really concerned doctors. They had just started a pulmonary clinic in Houston. And what they were saying was that 50% of their appointments were no-show appointments. Okay. Now, why did this matter? Well, they had a full staff, right? They had all the insurance. They had a huge P&L, right? But each one of these appointments that was a no-show cost them thousands of dollars in lost revenue every single appointment because it's heart health. And so Mike said, well, let me throw Kerico at this. And they have since been able to grow all across Texas, and wherever they grew, they brought Kerico with them. Kerico had a major impact on the bottom line of the clinic, but more importantly, the health of the patient, because there was a solution to get these patients into the pulmonary clinics, into their appointments.
Results before the doctor's results, right?
Yeah, and so what's really cool is, you remember, well, I don't know how old you are, Alex. I'm ancient. But when like Google came out, the term Google became a verb. Oh, Google it, right? Well, now amongst that particular pulmonary clinic, I think they've got like 13 locations throughout Texas. They say, call a Kerico. And I just love the sound of that. Call a Kerico, get a Kerico, just like get an Uber, get a Lyft. And so I think we're making progress, but again, for us, we want to grow as fast as we can, maintaining the quality of care that we offer.
Some of these independent drivers want to try and build their own business, and you gotta like pat them on the back for that. But joining a network like Kerico is not the worst thing in the world either. That would be a big help for them.
Well, yeah, I think for an individual who wants to drive and to care for patients, that is, if that's the calling, that's a good calling. That's a different mindset than to start a company, because, when you start a company, a lot of paperwork, a lot of operational procedures, hiring procedures, insurance. I mean, that's a big difference between being, the boots on the ground caregiver giving rides, which is essential, and then or wanting to be to managing your own business. I would say that, if you are capable of operationalizing a business plan, then getting into something like this is going to be up your alley. I learned in my career that I have certain strengths and weaknesses. And one of the things that, I'm in my mid 40s now, and I actually love aging because I can let go a lot of the BS that doesn't matter anymore. And what I've found in my career, and having tried to be an entrepreneur in my own right, I'm a better part of a team than I am an individual. And more to the point, I'm not someone who ever wants my face on a coin. I want to be the guy behind the guy. And fortunately, I get to do that in this job. I mean, I love talking to you, and I like to blabber a little bit, but really, our CEO, Mike Morris, he's the brains of the operation. And I'm just the guy who gets to talk about what a great job he's doing.
All right, I want to do one last thing because it seems like you're also a big sports fan, as am I. And at the end of these games, there's a bunch of ride shares outside the stadium, and imagine you partner with the Twins or the Vikings or the Timberwolves, or by the way, in the playoffs all of a sudden after like years. That would be huge if Kerico was at that ride share stand for people with disabilities. We don't have that. I don't see that at Yankee Stadium at all.
That's an interesting, yeah. I think if Kerico were to do something like that, because we do offer a door-through-door service, because we will be escorting someone in a wheelchair van, if they're in a wheelchair, there would, and I don't have an answer for you, Alex, but there would need to be a different formula than just rolling up to the curb and flashing a light.
Well,
Are you Alex?
Point,
are you the guy? Like there would need to be something a little bit more concierge based. And of course, I don't want Alex paying for that special concierge. It would be really great. If I can say this out loud, for these billion-dollar franchises to help pay for that. Let's get
That's
people.
What I'm saying. Have them partner with you and then invest in it instead of relying on Uber and Lyft. Invest in it themselves. That would really be a win for everybody, I think.
I think you're right, Alex. I think you're right. I'll noodle on that because we're, as I mentioned earlier, we're looking at things a little differently. Medical transportation is our forte, our bread and butter, but people need rides, man.
Well, on that note, you mentioned the oncology. Are you partnering with other hospitals around the country that are buying into this idea, literally buying into it?
We certainly are trying. You know this firsthand, and I know this because I'm also a patient, and my mom, I'm a caregiver to my mom. Every kind of, if you look at healthcare like a river with stepping stones on it, each stepping stone is made from a different material, meaning every hospital is different, right? Every healthcare plan company is different. And so, there are hospitals out there that might have a centralized controller for transportation. So if anybody in the gigantic hospital needs a ride, they call that person, and that person orchestrates transportation. Other large hospitals, every single department has to orchestrate its own transportation. And so you could have two hospitals, in which case Kerico works with one with the centralized transportation function, and that's a beautiful thing, and that's great. Or we could work with another hospital that might have 40 different departments in it, and I've got effectively 40 different accounts within that hospital to manage, 40 different people.
Amazing. That's amazing.
Right. And so for us, and not just for us, but for the transportation ecosystem, scalability is only possible with a really good centralized operational plan. And so if there are people out there listening to this podcast who work in these large hospitals or other large healthcare organizations, having a centralized transportation team doing the orchestration costs very little because you're only paying for one or two, three people. You are taking the added responsibility off of the shoulders of perhaps 100 people across the hospital. It's one less thing they have to worry about. You having an expert focused on nothing but transporting patients. And then for companies like ours, it's the most effective because when the email or the app request or the phone number comes in from person at such and such a place, we can deal with that versus, okay, what department from the hospital is this request coming in from? Is this at the west location oncology or the east location eye care? Which one is that? Oh, I've never been to the eye care. You know what I mean? So it all comes down to everybody works differently. Every organization has a level of effectiveness, and so we have to try and navigate, find out which organizations are have the most effective way of communicating the need for transportation. That's who we aim to partner with.
I want to say this. I feel like just talking to you the last hour, we've established that Kerico not only eliminates the financial stress in some ways, but also the emotional stress.
We say this, it's our job to make everybody's life a little bit better, starting with the patient, right? We want to make sure that patient is getting from point A to point B, not just safely, but with dignity. Our job is to make the provider's life a little bit easier so that if they have a full staff on any given day, that their patients get to their appointments and that everybody can feel good about doing their job. And also, we say what you will about the healthcare insurers, we want to reduce their costs because like I said earlier, every dollar spent on patient transportation for a preventative care appointment saves $11 in emergency room care. And so everybody wins. And that is our job. Our Kerico job is to make everybody's life just a little bit easier for that period of time.
Well, Chis Ochs, you are with Kerico, and remind us your title once again.
I'm the Chief Development Officer of Kerico.
Well, you are definitely working on development. I can see it. I can hear your passion for it. So come back on the show, and maybe we'll get Mike on with you as well at some point to discuss this app as it grows and this company as it grows into a multi-state accessibility sort resource, I guess I would say, right?
Yeah, Alex, we'll come back on your show anytime. Thank you so much for having us. Like I said, I've been listening to your podcast. I get goosebumps when I think about what you're doing. And man, thank you. Thank you so much. I really appreciate it.
And though this is a podcast, maybe people who are visually impaired don't read what's on the description. Tell us the website one more time.
Yes, sir. It is kericocare.com, and I'll spell that out. It is KERICOCARE.com.